Hello, Kent County. It's March 20th, and I'm here to give you an update on COVID-19. Today we learned there's 549 cases across the state of Michigan. We learned of 3 more cases here in Kent County, bringing our total to 12. At this time, we're still investigating those 3 cases, so I don't have a lot of information to share with you about them, but I will as soon as we have more information. I want to also remind you that because of the scarcity of the testing supplies and the safety supplies that are needed to conduct that testing, right now our hospitals are really overwhelmed with people wanting tests. And it just is not possible for everyone who wants to get a test to be tested. So at this point, most of our hospitals are limited to testing people who are sick enough to be admitted. So for mildly sick people, the CDC and other hospitals and levels of government are recommending that you stay at home and that you're not tested because of the scarcity of testing supplies. We also heard from the governor a little while ago, and the governor at this point is not recommending a shelter in place. You may have seen that other states have gone that route. I think that the governor's approach at this time is wise. However, I also think that it's important that all of us do what we can to reduce unnecessary travel. There's no reason for us to be out in the community or socializing or shopping any more than we have to. For those of you who work in essential services areas, whether it's healthcare or law enforcement or pharmacies or in manufacturing that produces essential parts and products, or any of a number of other services that are essential for maintaining society, we appreciate you. Thank you for doing the work that you do. Please continue that work. But I want everyone else to think about are my exposures, is the work that I'm doing, is it essential, or can I do it from home? Should I be out in the community doing my normal activities? For most of us, the answer is no. So at this time, it's really critically important that all of us scale way back on our normal activities. And I know that's a challenge, but I have a lot of confidence it's going to pay off in the long run. We've also heard from the governor that there is a 50-person limit on mass gatherings. The CDC is now recommending that mass gatherings be kept at 10 people or less. And while that's not a requirement, I would like for you to please heed to that. Let's do our very best to keep mass gatherings to 10 people or less. I know that's not many people, but the challenge in front of us is pretty extreme. It's important that we all lean in together to make this happen. Right now, we have an opportunity at this point in time to make it as difficult as possible for this virus to jump from one person to another person. And the best way to flatten this curve is for all of us to think about how can I reduce my exposure to the community and how can I protect those essential healthcare workers, those essential workers in other fields, and the most vulnerable in our community, the elderly population, and people who have underlying health conditions. I want to thank you for taking this seriously. And I want to really encourage you to share this message in particular, because I do truly feel that we're at a critical point in this pandemic, and we're at a critical point here in West Michigan. Now is the time to take this seriously if you haven't. I also want to encourage you, there's plenty of groceries. There are plenty of the supplies and the things that we need. There's not a problem in our supply chain, okay? So when we hoard products, that's creating an additional problem that we all have to work through. Shop for what you need, take what you need, but please keep others in mind. There's lots of more critical essential supplies coming to our pharmacies, to our grocery stores. Take what you need, don't hoard, very important. And as I was saying, please continue to share this message. It's very important right now. This is the moment for all of us to rise to the occasion and do what we can to make it very difficult for this virus to spread person to person. We can do this, but we need your help. I'm Dr. Adam London from the Kent County Health Department. Please share and like this Facebook page. Thank you.